Hello and welcome to our 5-minute medication review. Today we're going to be going over the drug Diltiazem. Diltiazem's trade name is Cardizem. Its classification is a calcium channel blocker, and it's carried 25 milligrams in 5 mLs. And we do currently stock 2 vials of this in our drug box. Just remember that this drug needs to be refrigerated. Its pharmacology in action is this drug is a calcium channel blocker, so it has an inhibitory effect on the cardiac conduction system. So basically, what it does is you have all these rapid electrical impulses traveling down from the SA node or the atria and through the AV node. And what calcium channel blockers do is they prolong the period of repolarization. So the time that it takes the heart to basically get to its resting state, it prolongs this. So it slows down all these rapidly firing impulses, and it therefore slows down the ventricle rate. So it will slow down the heart rate in that effect. Um, Primarily, we use this drug that is associated with atrial fibrillation and a flutter, but it can be used in other ways, which we'll talk about in a little bit. Um, so again, what this drug also does here is it inhibits extracellular calcium ion influx across membranes. But the biggest part of this is because of this, it inhibits the contraction, thereby dilating main coronary and systemic arteries. So anytime that these calcium channel blockers cause dilation to peripheral arteries, we can see a drop in blood pressure, unfortunately. So the indications is narrow complex tachycardia arrhythmias, so atrial fibrillation and a flutter. And then the other indication for this drug is SVT that isn't responding to our adenosine administration. Just remember, with SVT, our initial drug of choice is adenosine, but if that isn't effective, our next option is diltiazem. So some absolute contraindications is heart block or bradycardic rhythms. Systolic blood pressure is less than 90 because remember, with cardizem's effect of arterial vasodilation, it will drop blood pressure. So if we already have a patient that is quote unquote hemodynamically unstable with a low blood pressure, we should opt for synchronized cardioversion for these patients. Also, sick sinus syndrome and ventricular tachycardia. There has been some evidence that when given in wide complex tachycardias or instances like WPW and those type of things, reentrant loops can happen, and VTAC can degrade quickly into VFib, which we don't want. And of course, we're not going to give this medication to somebody who has an allergy to it. Some precautions and side effects of diltiazem is prolongation of the AV node conduction may result in second or third degree AV block. So, because you're slowing down that conduction velocity so much, it actually may cause heart blocks. So, that's a side effect to look out for. And again, it says use them caution with anybody who already has a compromised myocardium. So, patients with severe CHF, acute myocardial infarctions, and those type of things. However, this is a relative contraindication or side effect of this. So if the benefits outweigh the risk, and then using caution when giving to hypotensive patients. We can give this drug IV or IO. Its onset is 3 minutes and its peak effect is within 7 minutes. So remember, we give this to patients who are primarily in atrial fibrillation or aflutter with a rapid ventricular rate. So this rate has to be a rapid ventricular rate. Just keep in mind that it's not going to necessarily terminate the atrial fibrillation. What it's designed to do is just slow that conduction and just slow that rate down. Okay, so we give this for primarily those reasons, but we can also give this as listed here for stable SVT, refractory to adenosine, meaning so if adenosine isn't working, our second line drug of choice would be cardizem, and we would give 0.125 milligrams per kilogram, IV or IO max of 12.5 milligrams over 2 minutes. Patients greater than 65 can only get a max of 10 milligrams per dose, and you may repeat this once after 10 minutes. Um, Also, you can give this for stable, irregular, narrow, complex tachycardias. An example would be AFib, A-flutter, or multifocal atrial tach. With these, it's the same dose, 0.125 milligrams per kilogram to a max of 12.5 milligrams IVIO over 2 minutes. Again, if this patient is over 65 years old, 10 milligrams max per dose. May repeat once after 10 minutes as needed and as blood pressure allows. Some other things to consider, there's a lot of patients who take calcium channel blockers to control their blood pressure. And if you ever see these in the field, a lot of these drugs are your PINE type drugs, your PINE type of drugs. And some of those are like amlodipine, felodipine, nifedipine, nisoldipine, and et cetera. So these are your PINE type drugs. But again, you may see these a lot in the field for patients who are using these to lower their blood pressure. And I hope you learned a little bit of something about diltiazem today, and I appreciate your attention.